Newdol analgesic. Antipyretic composition. Each tablet of Newdol 500 contents. 500 mg paracetamol. Each 5 ml of Newdol. Paracetamol. Each 1 ml of Newdol 120 oral suspension contains 120 mg. 160 oral suspension contains 160 mg. 250 oral suspension contains 250 mg. Infant drops contains 100 mg. Paracetamol. Each one of Newdol 125 suppositories contains 125 mg paracetamol. Each one of Newdol 250 suppositories contains paracetamol BP 250 mg. Properties. Paracetamol is a para-aminophenol derivative, non-opioid, and non-salicylate. Paracetamol has analgesic, antipyretic properties and weak anti-inflammatory activity. Paracetamol produces central and peripheral analgesia by elevation of the pain threshold and inhibition of prostaglandin biosynthesis. Antipyretic action through action on the hypothalamic heat-regulating center, resulting in peripheral vasodilatation, increased blood flow through the skin, sweating and heat loss. Paracetamol is readily absorbed orally and rectally. The initial rapid response occurs in less than half an hour, and within 2 hours peak levels are achieved. Indications. Newdol is indicated to relieve mild to moderate pain in many conditions as analgesic and antipyretic. Newdol is indicated for symptomatic relief of headache, sore throat, rheumatic aches and pains, influenza, feverishness and feverish colds, in febrile conditions in children, teething, tonsillitis, measles, aches and pain following vaccination or immunization. Newdol is often the analgesic or antipyretic of choice, especially in patients in whom salicylates or other NSAIDs are contra-indicated. Such patients include asthmatics or children in whom salicylates are contra-indicated because of the risk of Ray's syndrome. Dosage and administration. Tablet. Usual adult dose, 1-2 tablets 4 times daily, maximum dose, not exceeding 8 tablets every 24 hours. Children, 6 to 12 years, 1 tablet or half tablet 4 times daily. Suspension. Infants, 6 to 12 years, 5 to 10 milliliters of Newdol 250. Or 10 to 15 milliliters of Newdol 160. Children, 1 to 5 years, 5 to 10 milliliters of Newdol 120. Or 5 to 7.5 milliliters of Newdol 160. Or 5 milliliters of Newdol 250. Infants, 3 to 11 months, 2.5 to 5 milliliters of Newdol 120. Or 2.5 milliliters of Newdol 160. Infant drops. Children, 1 to 3 years, 1 to 2 milliliters. Infants, 3 to 11 months, 1 milliliter. Infants under 3 months. The usual dose is 10 mg/kg of body weight, reduced to 5 mg/kg of body weight if jaundiced. Note: oral suspension and drops may be dosed every 4 to 6 hours, if necessary. Suppositories. Infants, 3 to 6 months. 1 Newdol 125 suppository I to 3 times daily. Infants, 6 to 12 months. 1 Newdol 125 suppository 14 times daily. Children, 1 to 3 years, 1 to 2 Newdol registered trademark 125 suppository 1 to 3 times daily, or 1 Newdol 250 suppository 1 to 3 times daily. Children, 3 to 6 years, 1-2 Newdol 125 suppositories 1 to 4 times daily, or 1 Newdol 250 suppository 1 to 4 times daily. Children, 6 to 12 years, 1 to 2 Newdol 250 suppositories 1 to 3 times daily. Overdosage. Immediate medical management is required in the events of overdose, even if symptoms of overdose aren't present. Paracetamol overdose may cause liver failure. Early symptoms may cause pallor, nausea, vomiting, diaphoresis and general malaise. Overdose should be promptly treated by gastric lavage followed by IVN, acetylcysteine or methionine without waiting for the results of plasma paracetamol levels. In all cases of suspected overdose, prompt medical attention is critical for adults, as well as for children, even if you don't notice any signs or symptoms. Side effects. Newdol has rare side effects at recommended dose. However, skin rash, other hypersensitivity reactions and hematological reactions occur occasionally. Hepatotoxicity after large dose or prolonged treatment. Contraindications. Newdol is contraindicated in hypersensitivity to paracetamol, chronic renal and / hepatic diseases. Pregnancy and lactation. Although there is epidemiological evidence of the safety of paracetamol in pregnancy and lactation, medical advice should be sought before using this product. Precautions. Newdol should be given with care to patients with impaired kidney or liver functions and in patients taking other drugs which may affect the liver. Drug interaction. Newdol absorption may be accelerated by drugs such as metoclopramide, and may be reduced if given within 1 hour of cholestyramine. Piperacetaminide can decrease paracetamol clearance and increase its plasma half-life. The anticoagulant effect of warfarin and other coumarines may be enhanced by prolonged regular daily use of paracetamol with increased risk of bleeding. Packaging. Newdol tablets. Blister of 12 or 10 tablets. Pack of 2 blisters. Blister of 10 tablets. Pack of 10 blisters. Blister of 12 tablets. Pack of 10 blisters. Strips of 10 tablets. Packs of 50 strips. Hospital packs of different sizes. Newdol suspension. Bottles of 60 milliliters. Newdol drops. Bottles of 15 milliliters with insert dropper. Newdol suppositories. Packs of 10 suppositories.